Sophia is a year and a half old. She's lucky to be alive. An estimated 9 out of 10 women in Germany decide to have abortions when they find out their unborn child has Down syndrome. Anna Thyssen was 7 months pregnant when she got the diagnosis.
Of course, I was scared. I was worried. I was also feeling a bit desperate. I didn't know what to do. I was still in the last year of my studies. But I had a lot of support and courage. And because she was so active in my belly, Sophia also showed me that she wanted to live. And she should be allowed to live.
The weeks that followed were difficult for Anna, who was also working as a geriatric nurse. She read all about Down syndrome, which is a genetic disorder in which children are almost always born with physical and intellectual disabilities. The doctor told Anna her child would be born with a heart defect. Suddenly, Anna faced the dilemma of whether to have an abortion.
They immediately told me I could have an abortion. But I thought, if I have an abortion, I'll have to give birth to a stillborn child. I didn't even want to think about that.
Caroline Hennig, a gynecologist, counsels women who decide to have an abortion when they get a diagnosis of Down syndrome. She knows the pressure for all involved.
There are so many factors to consider. How old am I? How stable is my relationship? Do my other children still need a lot of attention? I like to tell my patients that they just have to decide what's easiest for them.
Hennig says the blood test that detects Down syndrome as early as 10 weeks of pregnancy gives families time to make difficult decisions early on. That's also important to ensure that mother and child are well looked after if the mother decides to have her baby. For Anna Thyssen, the issue goes deeper. She says the blood test sends a message that society does not accept children like Sophia.
I ask myself why. And if you then don't have to pay for the test, these children will simply not exist. Even though they're perfectly happy children who radiate joy and have so much love to give.
The blood tests for Down syndrome are already a standard procedure in Denmark and France. In those countries, few children like Sophia are born.
I'm now joined by Peter Dabruck. He's the chair of the German Ethics Council, which advises the German government. Welcome, Mr. Dabruck. Now, you have spoken out in favour of reimbursing the costs of genetic testing. Why?
So thank you first for having me. I was not quite in favour of reimbursing the test, but my statement was we do not have sufficient reasons for not reimbursing it if we at the very same time reimburse the invasive tests. And that is the reason, it is a question of social justice, why we then should also reimburse this non-invasive test.
And for people who are not aware, Mr. Dabruck, can you explain the difference between an invasive and a non-invasive test in this context?
Yeah, of course. We have first the amniocentesis, which is invasive, and it has the risk of 1 to 3% of a failure in or a sudden birth, and the blood test has not this adverse side effect, and therefore there are good medical reasons since they have the very same results in terms of medicine, to also reimburse the non-invasive test. But of course, we have further societal questions to tackle.
Absolutely, because associations for people with disabilities say that this sends a signal that people with Down syndrome are not wanted. What do you say to them?
That is a really serious question, but I think the one hand is the conflict on the of the parents, the woman who is pregnant, and on the other hand, the societal effect.
Now, Iceland does provide such tests for free of charge and the possibility of terminating a pregnancy after a Down's positive result. As a consequence, almost no children with Down syndrome are being born. Now, some German politicians have already voiced concerns. Let's listen to what one Green Party politician had to say.
Our health system is meant to heal people. This test cannot heal Down syndrome because Down syndrome is not a disease. We can't heal it, and we're not supposed to. So what's this all about? This screening is designed, and we should be very clear about this, to select children without this condition.
OK, so what do you say to this? What is your response to this, Mr. Darbrook? How should one deal with this risk of selection?
I think this is a point mostly seriously taken into account because on the one hand, I think we have to do everything to improve a culture of inclusiveness of all different forms of human beings and human persons. So therefore, I'm very much in line with all, and I had the impression it were nearly all parliamentarians who were in favour of this attitude, and I was impressed by this very general approach of the parliamentarians. But on the other hand, we also have to take into account that that parents, that mothers are really struggling. Am I ready to accept this? Well, it is a more difficult life. And the best answer to this is not to, on the one hand, reimburse the invasive test, and on the other hand, not the non-invasive test, but to do everything to improve and support all lives and relationships with people, and not only trisomy 21, people who do not meet the expectations of the society.
Right, it's a big ethical question. Peter Darbrook, Chair of the German Ethics Council, which advises the German government. Thank you very much for sharing your thoughts with us on DW.
Thank you.